I'm Jerry Zeidenberg, editor and publisher of Canadian Healthcare Technology magazine. I'm excited about this webinar because it will demonstrate how analytics have been used in a real-world setting at Quinte Healthcare in Ontario to improve patient care during the COVID-19 pandemic. I wanted to mention that during our presentations today, we thought we'd use a few pop-up polls to ask our audience their opinion of analytics at their own organizations. So you will see 3 quick polls that you are free to participate in. We'll share the results as we go along. I'm now delighted to introduce our 2 speakers for today. First, we will hear from Tara Myshrall, who is Public Sector Manager at Information Builders. Tara is an experienced account executive for the public sector at Information Builders. Over the past 10 years, Tara has built a community of practice for organizations in healthcare, law enforcement, and municipalities by understanding and focusing on the needs and objectives of public organizations. After the remarks by Tara, we will hear from Peter Papadakos, who is Director of Decision Support and Analytics, Health Information Services, and Chief Privacy Officer at Quinte Healthcare in Belleville, Ontario. Peter has more than 2 decades of experience with a passion for data and analytics. With a background in computer science and economics, he started his career at Sunnybrook Health Sciences Center, managing system implementations. He has also worked at the Cardiac Care Network of Ontario, developing dashboards, scorecards, and automated reporting, and he also contributed to research papers. His next role was as Senior Business Analyst and Manager of Case Costing at the University Health Network in Toronto. Peter then moved to the Ministry of Health and Long-Term Care as Senior Manager of Data Development. He has been at Quinte Healthcare for the last 9 years, serving as Director of Decision Support and Analytics, Health Information Management, and Chief Privacy Officer. Now, now to start things off, I will hand over the microphone to Tara of Information Builders.
Thank you very much, Jerry. I appreciate that. I'm just going to quickly share my screen and we can get started. Great, thank you so much. And it is my honor and privilege to be here today with all of you to talk about how we have leveraged in technology at Quinte Hospital and how they've adopted analytics to improve patient care and resource management. But first, I'd like to take an opportunity to talk a little bit about data and what data is bringing to the table when we can access it through analytics. So the data reality is not what we might think. Data is really difficult to access. And if we look at our systems in healthcare, there are a slew of proprietary systems out there, and that's not getting any less or easier. And you couple on top of that all of the privacy issues with that data, and accessing it becomes even more difficult. We've heard that organizations have silos, and it's very difficult to get a holistic approach to managing that data that we have in our environments. Once you access all those data systems, though, the information that it provides is still not trusted. We've learned that that is one of the major issues in today's environment from Gartner, that poor data is making it very difficult to gain any business value, and this negatively impacts the performance or patient care. Tools are also hitting the wall. What we mean by this is there's several different tools out there that give you the ability to access that data, but these tools are not leveraged by the majority of the organization. In fact, BARC says only 17% of employees in an organization are able to leverage this information gleaned through analytic tools. Our goal is to help access the other 23% and ensure that we can help with user adoption so that we can make evidence-based decisions off of clean, complete data. The landscape is changing in healthcare, of course, because everybody's talking about visualizing data, but visualizing the data is only one small part of the process. End users are creating their own stories based on the data that they have access to by not being able to access the complete picture. We need to find a way to bring all of our data sources together in a frictionless manner so that we're able to access the complete storyline. And we're hearing more and more that the cloud is the way to go. Old worries about accessing data in the cloud or having information in the cloud in a secure way so that our patient data is safe is now no longer an issue. So more and more healthcare organizations are looking to the cloud to eliminate high infrastructure costs, to have secure, safe data and patient information, and to be able to focus on the information as opposed to the infrastructure that it takes to access data. Data is the key enabler of growth, and being able to get a complete picture of our patients throughout their entire care journey. So if we're going to have a chance with being able to provide timely and accurate data, we have to start with trusted data. And that is much easier said than done. When we look at the slew of systems that are within a hospital or outside of a hospital about our patients, there tends to be several different variations of the truth. We have to be in a situation where we can access that information and take the next step. Everybody's talking about AI and predictive capabilities, but the real source of AI is making sure that you've got trusted data. They always say garbage in and garbage out. We have to be able to, once we have that information, distribute it through the entire user paradigm. It makes no sense if only 17% are accessing that information. We can't have compelling change for our patients if we don't have access throughout the entire care continuum and throughout all of our organizations. So our goal at Information Builders is to make sure that we have data and analytics that embeds intelligence into everything we do. Who is IBI at a glance? I'm still surprised after being here for a decade that so many people don't know Information Builders. But Information Builders has been around since 1975, and we have very deep experience with healthcare organizations. We started with the 5G language, and we've made sure that we have continued to focus on data and focus on accessing data and data management. We've got tons of awards in user experience, and we're really lucky to have strong clients like Quinte Healthcare who've been with us for a substantial amount of time. We were founded in 1975, as I said before, but we've kept our mission the same. Access data, make sure it's clean, and send it out and disseminate it to everybody. And because of our industry-specific solutions, our solutions are geared towards healthcare organizations. We have a polling question. So the first polling question is, how has COVID-19 affected your strategy with implementing analytics? We found at Information Builders that our customers have been able to respond quickly. By having access to their data, they've been able to make rapid changes and quickly respond to the patient's needs and their resource constraints as a result of the pandemic. We've worked with several organizations across the globe, but I'm very proud to say that I have quite a few in my portfolio right here at home in Ontario. Quinte is one of many hospitals that we've worked with, such as Brant and Queensway Carleton, Guelph, Joseph Brant, and a slew of others. But across the border, it's no different. We also have a tremendous amount of clients there, and St. Luke's is one that I always love to talk about, because they were really able to take their 300 different unique sites and gather information from all of those sites so that everyone could access that same source of truth. Their goal when implementing Epic was to ensure that they had unified, universal data that could be accessed by all. And we're proud to say that they chose us to make that decision. So with that, I'd like to turn it over to my friend, Peter Papadakos. Now, you've read Peter's bio and you've heard Jerry do a great job of telling you all about him. But it's been my pleasure to work with Peter for the last 9 years at Quinte Healthcare. He's done several presentations with us, and I'm sure you won't be disappointed. But he's not only a dynamic leader, data has always been a passion of Peter's, and he's done a wonderful job equipping his team with the ability to make data-driven decisions. He's been able to focus not only on how to leverage data within Quinte Healthcare and the sister sites, but also through accessing external data through HealthLinks and other organizations. He's been an advocate for data analytics in the industry. And when he's not out there changing the world, he's a fantastic father to 3 beautiful young girls. So it's my pleasure to turn it over to Peter, who will take you through his journey and how he leveraged analytics to really make a difference when COVID hit with not only his resources, but his patient care. Over to you, Peter.
Thank you, Tara. You're too kind. And good afternoon, everyone. Thanks for joining. I'm just going to share my screen with you now so I can go through a presentation. Okay. So thank you for all attending, and I'm very happy to be speaking with you today. So COVID-19 has impacted all of us through stage restrictions, supply chain disruptions, separation from friends and family, and in some cases permanently. The pandemic has turned our worlds upside down, yet technology, data, and analytics are providing opportunity, insight, and promise. Our current environment reminds me of the ancient blessing or curse. May you live in interesting times. To admit these are interesting times is an understatement. Along with the pandemic, we are seeing the emergence of Ontario health teams, increasing healthcare costs, growing surgical, diagnostic, and oncology wait lists, America First politics, and the opportunities of innovation, collaboration, AI, and big data. I've been involved in healthcare and data analytics for over 20 years, and I would say today's time is the most interesting that I've seen. Let's go to the slide. So I'm just going to have this slide up here, and I'll do a further intro, and then I'll move into the presentation. So the pandemic has made it clear that data is critical to make prompt and correct decisions, and that analytics can drive efficiency in healthcare to solve future problems. Accessing, aggregating, transforming, and reporting on data is mission critical. For example, we now know that to determine the need for hospital supplies, such as masks, gowns, and even ventilators, that analytics are necessary. Many hospitals have been severely capacity constrained, and embracing analytics to strategically identify capacity and predict ICU and hospitalization rates will keep us one step ahead. In planning for future surges, analytics is key to demand-supply matching. Even within a facility, providers can use these tools to identify resources, such as underutilized beds that can be repurposed, or additional medical devices and diagnostic equipment. COVID-19 has caused a rapid transition to expediting the use of telemedicine or virtual care. By leveraging existing tools, healthcare professionals can successfully triage, diagnose, and treat these patients remotely for conditions. During the pandemic, these systems have been well utilized, lowering the risk of infection for patients and caregivers. Can advanced predictive analytics be used to anticipate demand for these services and match patients with the right primary care physicians, specialists, nurses, and technicians? Probably. Healthcare providers are challenged to segment non-COVID patients from those infected with the disease and to triage these patients based on risk. By risk stratifying patients based on demographic data, electronic medical records, and socioeconomic determinants, health providers can proactively identify and prioritize the most vulnerable patients. To do this most accurately and assure optimal outcomes, data-driven stratification systems can adopt descriptive and predictive analytics, machine learning, and natural language processing. And lastly, forecasting demand for critical drugs and equipment. The COVID-19 pandemic has presented unprecedented and unforeseen challenges when it comes to the provision of medical staff, equipment, protective attire, drugs, and devices for hospitals. Can leveraging demand data from this and previous epidemics help forecast demand for any future COVID surge, as well as future similar health events? By incorporating demand data from this pandemic with enterprise resource planning or supply chain management systems and augmenting it with advanced predictive analytics, healthcare providers can significantly improve their levels of readiness. In summary, there are a number of pressing challenges on our healthcare providers and professionals right now and in the foreseeable future. Many of these could be helpfully managed with the assistance from data analytic tools. What data insight gives healthcare staff is the ability to make better, more informed decisions. This couldn't be more important than right now. Okay, so just going to move this over here. Okay, so the agenda. I'll give a quick overview of Quinte Healthcare, and then we'll get into COVID-19 crisis and data gaps, agile development, improving care resource management, and user adoption. So Quinte Healthcare is 4 sites, and we have around 1,800 staff and 300 medical staff with many different service offerings. This is a map of where our sites are. So way up in the north is the Bancroft site, and down further on the south side of the map, we have Belleville, Trenton, and Prince Edward County. So those are our 4 sites. We're just west of Toronto and, east of Toronto and west of Kingston, kind of in the middle there, in case you didn't know where we were located. The decision support and analytics team at Quinte Healthcare consists of these skill sets, and there is some redundancy across the staff as well. So we have experts in some areas, and then everyone knows a little bit about everything as well to keep us well-rounded. And it's really a it's an independent unit from the perspective of we have all of the skill sets needed, from extract, transform, load skill sets, all the way out to statistical and machine learning skill sets, and everything in between there. From a business intelligence maturity curve, there are many models out there. This is one that's nice and visual. It's easy to grasp by quickly looking at it. When we first started on this journey, we were right at the bottom of this curve. So there was a lot of Excel spreadsheets. There was a lot of manual processing, not a lot of automation. There definitely wasn't self-serve in place. And over the years, we've gradually moved up the curve to, you can see where it's circled there, where we do statistical analysis, and we've started doing some predictive analytics as well. And we hope to keep moving up that curve. So COVID-19 crisis and data gaps. In March, our COVID-19 response, so no surprise to anyone, quickly became our top priority. The entire organization was focused on this. How do we keep our staff and patients safe? From a reporting perspective, from a reporting and analytics perspective, we asked what information needs to be monitored and how will this information be communicated? One question was, how will our catchment area be impacted? from a volume perspective, supplies, etc. By using various models for forecasting best and worst case scenarios, based on international available data at that time, the organization began preparing. While much of the data needed was available, we quickly realized there were a number of gaps. For example, PPE inventories. We weren't really sure where they were, how many were people using. Monitoring and usage, human resource data with respect to skill sets, drug inventories, usage and forecasting, and real-time reporting on swab results and locations of patients, just to name a few areas where we had some data gaps. To have a single source to find operational, tactical, and strategic data and information, which is important to have that one location where people could easily access it. We put together a portal within about 48 hours. And while it wasn't beautiful, as you can see, it's very Spartan, so to speak, it did contain 70 to 80% of the information needed. So what was shown on the landing page is a combination of what is happening in the community. So we had community data coming in automatically, and surrounding public health units as well, determining from that what expected activity might reach the hospital. So based on monitoring what was happening in the community, we could predict fairly accurately if we could expect someone to show up at our emergency department and if they were going to be admitted. And determining from that if we needed to change staffing, etc. So it also shows current activity in the hospital, occupancy rates. Are there any positive cases where they are in the hospital? Suspected cases in the hospital and where they're located as well. New content is added to this portal on a weekly basis or more frequently if needed. And as are adjustments to reports and data sources, it could happen daily, it could happen weekly, depending on what it is. So this is a screenshot of some metadata. So as new data becomes available to us, or analysis and reporting needs change and grow, working at this level, the synonym level or the metadata level, allows flexibility and agility without impacting existing reporting and analytics. Transforming and integrating data sets and data points in a seamless, agile way has been very important. And we also have the reusability of this metadata as well, so it can be used across many other areas. So what's shown here is linking a number of different tables together to get an understanding of what's occurring and doing analysis with that data. So across the institution, all the business areas, surgery, emergency, lab, diagnostics, etc., had questions, and they had high demand for information throughout the last, since March. So through working with the business area iteratively, the reporting and analytics become increasingly useful and accessible because the data is extremely relevant to them, because we're sitting with them and doing it in real time. And education occurs during development and testing. So there's a high adoption rate when done this way with this approach. So the business area becomes the owner in essence of the applications. And in some areas, adjustments and tweaks to the reports themselves and applications themselves are done by the business user. So they're creating their own versions of the initial copy, so to speak, of the application that's most relevant and useful for them. As an example, what has that done to the decision support department? What has it meant to the decision support department? Well, we've seen a large reduction in recurring operations, which has allowed us to do more advanced work, more advanced projects. Because of the organizational focus on a common goal, so the common goal of keeping our staff and our patients safe, because of this singular focus, it's really accelerated data development, analytics, and user adoption. Improving care and resource management. So this is a screenshot of a PPE application that we built. At the outset of COVID-19, we had a run on PPE and did not have a grasp on inventories. It looks like a poll popped up there. So at the outset, we didn't have a grasp on our inventories, control, or true demand for various PPE products. To correct this, we developed an application to take PPE orders. So each department in the organization orders PPE through this application, and it is recorded in a database. This way we can understand ordering patterns and improve control through accountability, because to order it, you need a user ID. The information is also linked to activity and diagnosis information, which allows for an understanding of the true need for PPE by department. This work has helped to get staff and patients to keep staff and patients safe, while improving the management of these resources as well. Okay, since mid-March, we have seen our ED activity drop significantly and are only now seeing close to pre-March volume. During this time, physical distancing and PPE guidance were having an impact on wait times in the ED. So despite seeing lower activity in the ED, the wait time was rising as staff and physicians couldn't see as many patients because of the protocols that were put in place. We used analytics to develop automated reporting for physicians to apply for temporary increased funding for the EDs, which they received. We've also created numerous reports and metrics for the ED and other departments to inform staffing, PPE usage, and risk associated for staff and patients. And understanding the supply of relevant drugs and days on hand was also a data gap that we had. We now monitor inventory and forecast days on hand. In tangent to this, we model scenarios around drug usage depending on volumes of COVID patients and severity of those patients, which can dramatically change how many days on hand you have. As COVID-19 cases began to drop off in Ontario, we needed to start reopening and to create our new normal. Using analytics to monitor occupancy levels and understanding where across the institution activity was returning to normal, and where some attention would be needed to ensure patients were not being negatively impacted because we weren't returning to normal. So users access this reporting and analysis daily for decision making and to recreate our business. For example, we have seen a huge growth in virtual care. Depending on the user and the purpose, different tools and analytics are made available. In the screenshot above, it allows visual discovery of surgery data to identify services, procedures, urgency, and turnaround time information. Our reporting allows us to understand our surrounding environment as well. So this is an example of all of the public health units in Ontario. The data comes in automatically daily. And the metric is, do you have 10 cases within 100,000 population within the last 7 days. If you do, it's red. So we can monitor that kind of information, and we have a mapped scenario around COVID risk as well that does that. So our adoption rate has climbed over the years, and the frequency of use has also shifted significantly. So, you know, prior we would have some individuals accessing analytics on a daily basis, but not a lot. And it's shifted greatly where the majority of users are accessing analytics on a daily basis. So adoption is key to decision-making empowerment. Prior to COVID, on average, we would have about 1,400 reports that were run daily. And this doesn't include auto email reports. This is users going to a portal and running a report. Now we are seeing over 3,600 reports run daily, a huge increase. So where, from another lens, maturity level lens, from a goal perspective, we are at the improve and innovate area. On this line, form, we've covered off all of this, and now we're right about here in the middle of these two. And from a time perspective, we're at the hour in real time section. And from a location perspective, we're here at business partners. So we are moving along that curve, I'm happy to say. And there are other models out there that I'm sure everyone's aware of. And I hope to start using some other models too to measure where we are from a maturity level. One of them is the healthcare analytics adoption model, which I'm excited to try to use next to map out the maturity of our organization. And that sums up my presentation. Thank you.
Okay. Well, thank you very much, Peter. We have some questions now that we'd like to ask. And the first one is, with the rise in user adoption of analytics, which programs did you put in place to make it happen?
Do you mean what was the strategy to increase user adoption?
Yes, exactly.
Well, I think, one of the main things is to make relevant content for the users. So, I would say that working with that business partner hand in hand to develop the needed metrics and the tools or the visuals or the dashboards that are really most relevant to them is one thing. And then the other thing is education. How do you access it? How do you interpret it? That kind of thing. And then data literacy. So really helping the end user understand what is the data that you're looking at? How do you interpret it? So I think those three things were a big part of the strategy to increase user adoption.
Okay, great. Another question is, what is next for your data and analytics program?
Well, what we're really, as I mentioned during the presentation, this COVID-19 emergency has really accelerated our data development as well. And so we have created a number of new data sets that will be key to doing more predictive analytics and machine learning projects. So I'm quite excited about that. It would have taken us much longer to develop these data sets out if we were in a situation of business as usual, because we would have had a lot of other corporate projects that would have taken the attention and resources. But this has actually sped up us getting some data points that are very important for some proven predictive models out there that we can reuse here.
Right. Okay, we have another question from the audience. Can you describe different types of supply chain data which are available for decision making, re COVID? Are these supply chain data collected uniformly across the province, or do available data differ across hospitals, LINs, etc.?
Yes, it does differ. So in our LIN, we have a company called 3SO, and they handle a lot of our larger purchases. And I believe every LIN, you know, some LINs might be sharing the same type of organization, but there are many different ones in Ontario. And what we do is we have 3SO automatically drop on a daily basis in the morning at some point, 7 a.m. or 8 a.m. They drop a file automatically into an FTP site. We then, our SQL server picks it up, processes it. So we get all of that data in every day, which is nice. And then we can tie that. I showed you the PPE order entry form. And so people are entering what they need, et cetera. So we can tie those two data sets together, and that really helps make informed decisions.
Okay.
When it comes to drugs, that's a little bit different. We don't have an automated feed from a supply chain perspective, but we do have our internal usage, and we can monitor that more closely now.
Right. Here's a question about technologies, and of course you're using information builders, but an attendee wanted to know what technologies have been used to extract and present the various examples. Is that information builders, or is that through other parties?
So for, primarily for ETL, we use SQL. We also use an information builders product called Data Migrator. And then at the extract level from our health information system, we primarily use a different company called, I think it's called Echo. Yeah. And then to present the information and to do analysis, it's a IBI product called Web Focus.
Okay. You were talking about, or in our poll actually, we had a question about barriers to the use of analytics, and the biggest barrier seemed to be culture in hospitals. Can you comment on the culture towards analytics and data in general at Quinte Healthcare? Who's driving it, and how do you actually create or improve the culture of data analytics?
Yeah, I think it's an insatiable appetite here for data analytics. So, when we first started introducing business intelligence here about 9 years ago, there were very basic questions that people needed answered, right? Like, what is the average length of stay in the emergency department, right? And they would ask us that question, decision support, and then we would get back to them in a day or 2 days with the average length of stay. So, and then that went from, that kind of scenario to, you can get it yourself now, right here. And not only can you get it, you can see it at any level you want. You could see it by triage level. You could see it by the 90th percentile or the 50th percentile. You could do it for certain types of patients. You could do it for different age groups, and it's right there for you. And if you create something that you really like after you do your slicing and dicing, you can save that, and now it's yours forever. And if you wanted to share it with your team, you could schedule it to go to your whole team every day, right? So by looking at what they want, what are your questions? And then enhancing the response and showing them how to access it and use it showed the value in analytics and BI. And then the questions, of course, got harder. So after these questions were easily answered and they could look through the data, they started to ask more questions. They wanted to know, instead of what's the average length of stay in the ED, instead they wanted to know what's the average length of stay in the ED for this particular type of patient, how long does it take to get their imaging done, what drugs are ordered for them, and how long does it take them to get those, et cetera, right? So the questions get harder and harder. And so we try to automate that as well, right? And over time, you do this with each business area and they really start to see the value in it. And there is something to be said with the maturity of the user and how do you gradually move them along to see the value in it, right? And so that's really the strategy.
And for questions like that, the questions become more complicated. How long does it take to answer a question? Is it instantaneous? Does it take a while?
It depends on the question, of course, and how serious the decision is going to be based off of the answer. So right now, the majority of users answer the simple questions themselves, and even some of the medium questions themselves.
So they can go in and use the tools themselves. It's that user friendly.
Yeah, and I think that's another inhibitor to to adoption is how user friendly is it? How hard is it to find stuff? And so we redid our presentation a couple of times to make it easier for the user. So we would survey users yearly to ask them a number of questions about that. And we would also sit down one-to-one and do human-computer interaction or usability studies with users too. Like, for instance, show me how you get to this and how do you use it? And then we would try to improve that process to make it easier for them to get to. And then we would survey them afterwards. Is it easier now? Is it better now? And so we would keep track of things like that and notice the improvement and adoption go up as well.
Okay. And we have one more question, and it's about COVID. With COVID, how quickly and easily are you able to create and implement new key performance indicators, KPIs?
Oh, they could, I mean, it depends what they are, but if I think about what what the indicators might be, I would probably say within about 20 minutes, maybe faster.
Yeah, so
at this
fast.
point.
Yeah. Right, very fast.
I mean, there was some, we have community assessment centers, 4 of them in the area. And when COVID started, we had, we created access rights to our internal system so that the assessment centers could record information in our health information system. So they would get swabbed at the assessment center, and that swab would be sent to Kingston General to do the actual lab work. And then the result, we would get the result and then enter that into our system. And so so that's kind of external. And then over the last couple of months, we purchased our own system to process swabs. So now we have people here at the hospital processing, doing swabs as well. So we have external data sets, internal data sets. And so if you ask me, how long would it take to create a KPI of the external and internal turnaround time for swab results, then I would say that would take about, right now, that would take about half an hour to do. There'd be some integration that I would have to do. And we are doing it over the next couple of weeks. So that's a more, one on the higher end side that would take a little bit more work.
Right. Peter, we do have one more question. I misspoke earlier. We have someone who wants to know, what is the technical platform that you're using? Microsoft, SSAS? Can you comment on the underlying platform, I suppose?
It would be an information builder's product called Web Focus.
Okay. Right. Okay, and with that, I believe we've run out of time for today. So I would like to thank today's presenters, Tara Myshrall of Information Builders and Peter Papadakos of Quinte Healthcare. And I would also like to thank the audience for taking time out of their busy schedules to listen to today's webinar. As mentioned, we will be sending attendees a copy of the webinar by email. And I wish everyone a great day and a great rest of the week. Bye for now.
Bye, everybody.